Or, of course, I'm still keeping an eye on traffic this morning, but with the coronavirus outbreak, there are a lot of questions on everyone's minds right now. We're working hard to answer them here at KCTV5, and today we're speaking with the mayor of the Unified Government of Wyandotte County, Kansas City, Kansas, Mayor David Alvey. Mayor, thank you for joining us this morning. We appreciate your time. First, can you give us an update on the latest of COVID-19 in Wyandotte County and Kansas City, Kansas?
Yes, I think right now we're at 28 confirmed cases and we've had 2 deaths. So those are the basic stats for that.
And we're in day 3 of the Stay Home KC initiative that you were part of the announcement for on Sunday, along with Kansas City, Missouri Mayor Quentin Lucas. What is the feedback that you're hearing from KCK residents?
Well, I think what we expected. First of all, I'm getting from some people, thank you for doing this. This is necessary. We understand how disruptive this is. And from others, I hear this is very disruptive. Why are we doing this? And how long will we have to do this? And so I think it's just natural for all of us to feel frustrated with the situation, to have any kind of limits upon, our movement, what we're able to do, not able to go out and enjoy restaurants or bars, not able to go shopping, not able to go and visit family and friends. I'm not able to go visit my own mother who is in a long-term care facility. So it's what we expected, that this is a very difficult situation and it's putting a lot of stress on people, I think. But also there are people who are trying to cope as best they can and adapt. And so that's taken a lot of effort. I know from the Unified Government side, as we tried to move as many operations as possible into virtual or digital remote, that took a lot of work just to do that. But the advantage of that is it opens up to us new possibilities as we move forward.
And speaking of moving forward, you and the commission and city staff are nearing budget talks for 2021 budget. How has the epidemic changed what those conversations consist of moving forward, or does it change it at all?
No, it absolutely changes it. Just as our families across the community are out of work sometimes, not able to work as much, that's going to impact what they're able to afford. It's going to be the same thing, I think, for the Unified Government. We depend a lot upon the sales tax, especially the revenues generated from the Legends and Village West. That's going to be impacted significantly. And we also, a lot of our income does come from the Board of Public Utilities through what is called the pilot, a payment in lieu of tax. And with production down, especially across the industrial space and the commercial space, we're going to see fewer revenues coming off of the pilot. So we're going to be facing some tough times. And again, what we do with that, I think, is really paying very close attention, to be very strategic with our expenditures to make sure that when we do and where we spend money, it's going to be generative of growth and of providing just the basic services.
And last question quickly, if there's places that people need to go for help, that they're hurting financially, what resources can they appeal to in Wyandotte County?
So I would recommend, first of all, that they go to the UG website, and you'll see there's a link there for all things COVID. So I recommend you go there, and then they're going to link you up to what is available not only at our level, but at the state and the federal level.
All right, Mayor David Alvey, thank you very much for joining us this morning. That website, of course, wykokck.org. Now, this is a continuous segment we're going to be doing here on KCTV5 News this morning. Tomorrow, we'll be talking to Kansas City, Missouri Mayor Quentin Lucas. Joe?
All right, Bill, thank you so much. It is important information that people need to know. There's so many questions, and with each city and town in the metro, all of them kind of vary in some way, so important to get this covered. Thank you.